A very good afternoon and welcome to our session on topic common birthmark and minor skin markings in newborns. We are glad to have Dr. Harish among us today to help us understand the topic. The doctor will help us understand more in details. If you have any doubts, any queries, put that on the comment section. The doctor will take up the questions at the last of the session. Be there for the whole session so that you don't miss out the important details the doctor is sharing. Thank you, doctor. You have the stage now.
Hello everyone. I'm Dr. Harish, Senior Consultant, Apollo Cradle Hospital, Koramangala. So today we are going to discuss about the common skin lesions and birthmarks which we see during the newborn period, and this is the most common concerns for the parents. There is myth around whether the skin lesions and the birthmarks going to there forever. So today I'm going to answer and I'm going to discuss a few of the common skin lesions and birthmarks. Uh, so So we are going to start with some of the common cutaneous skin lesions that we see when the baby born. The first and most common lesion, what we call as transient cutaneous lesions, are also called as erythema toxicum. So this lesion, it's most of the times it is seen in term babies, means the babies who are born after 37 weeks. The reason for these lesions are unknown. Generally, it's seen between 1 to 3 third day, and usually it's seen on the trunk and on the face and extremities. Most of them will resolve by 2 weeks, and this is how the lesions looks like. This erythema toxicum looks like a small macular lesions which you see on the trunk, on the genital region, and on the behind the ear and in front of the face as well. Generally, these lesions are self-limiting. It goes on its own. We don't have to have apply anything, or we don't have to apply any medicine to make sure the lesions go away. The second common lesion, what we see is transient neonatal pustular melanosis. The name itself says there will be a dark in lesion and it will be pustule, means the pus kind of thing will be there. This you will see sometimes since the time of birth. You will see the most common locations will be on the forehead. You can clearly see here. So there is a pus kind of thing, the pustular markings, pustular swellings also you notice on the cheeks. The most common locations being chin, forehead, on the back, buttocks, and palms and soles. The genderly, the most it can appear either in male and female in equal proportion. It always seen in term children more than the preterm, and as such, these lesions are also self-limiting. The third lesions that we see is acne neonatorum. So acne neonatorum is again occurs in about 20% of newborns. This is not an unknown lesion. This is caused by a virus or the parasite Malassezia furfur. So which is an inflammatory response to the present parasite. So this occurs by 2 weeks of age and resolves within first 3 months of age. These kind of thing requires antifungals, mainly imidazoles and ketoconazole is required. So most of the time, these are also is not life-threatening lesions. This will slowly will go away. So you can see these are the acne neonatorums which we see. Okay, many of them does require supplementation or sorry, the treatment with imidazoles and ketoconazoles. The next one is what we call as seborrheic dermatitis. This is something which is very concerning to the parents because this it lasts for longer days and it is quite scary also because there is a lot of scaling and skin will be adhered to that. This is most commonly seen in the anterior part of the skull, and sometimes there could be associated crusting and scaly lesions. We'll see what we call as cradle cap. So when we remove that cradle cap, the underlying skin surface will be quite erythrodermic. So this is the cradle cap that we usually see on the babies. Generally, it begins like around first week of age, and first to 1 to 3 weeks we say, and it can last up to months. It can go up to sometimes till 1 year of age. So the treatment very mild shampoos are recommended to remove the scale or crust. Generally used creams are ketoconazole creams in case of extensive or persistent cases beyond certain age. So steroids may be used in only in case after discussing with a dermatologist. Otherwise, the steroids are generally not indicated for the neonatal seborrheic dermatitis, as most of them will go away by 1 year of age. Then the next common lesions, the skin lesion that we see in a newborn period, what's called as milia. So the milia is generally seen around in about 15% of the newborns. Most commonly we see on the face, especially on the nose and the oral cavity. As you can see in that picture, there is a, small whitish macule which you see that is on the palate and on the gums as well. The one which you see on the palate, what's called as bones nodules. The other one is called as Epstein pearls, which you see on the gums. So generally, it resolves by 1 month of life. So in case there is a wider distribution and other things are there, then only the treatment is required. There is one more lesion, what we call as miliaria. The miliaria, this is what we call as prickly heat or heat rash. This we see when we swaddle the baby with too much clothes, and then also you can see these lesions. So the basic reason for the appearance of these lesions is the sweat gland ducts or get blocked, and then that leads to the appearance of what we call as miliaria. So it usually is seen in the baby's chest, back, underarms. So in those sites, we see this. Um, this also is a self-limiting site of lesions. You can see these are the miliaria lesions. This mostly seen in darker skinned people, especially behind the ear and the back. So these lesions, what we call as miliaria crystallina, and in whitish people are in the more they'll see like what we call red, the generalized erythrodermic lesions, what we call as miliaria rubra. Again, these lesions also are self-limiting. We don't have to treat these lesions as well. So the other normal skin lesions that we see is this desquamation, that is the skin peeling. So there's no particular reason why it happens. Generally, it happens in those babies who are born close to the due date of the mother. Otherwise, also sometimes beyond the due date babies, what we call post-term babies. In those babies, we see this desquamation. So this is completely normal, nothing to be worried of. So generally, applying moisturizers will help improving this condition. So this is what we see sometimes extensive skin peeling we see. The older skins will be peeling and the newer one will replacing that. So these are the common skin lesions we come across. As I discussed, the cutaneous lesions, then neonatal pustular melanosis, acne neonatum. Among this is the only one which has an inflammatory response to a fungal Malassezia furfur. The rest all is the reason for this is unknown, and seborrheic dermatitis, milia, miliaria, and desquamation. These are the common skin lesions that we see after the baby being born. Then come related to the birthmarks. So, what are the birthmarks we'll see in newborn babies? The first and the foremost important is hemangiomas. The hemangioma is something which is basically a pinkish, elevated surface, elevated structure which you see on sometimes on the baby's skin, especially on the forehead, on the back, sometimes on the cheek, on the shoulder. So many areas we will see this. The reason being, basically, it is because of the blood vessels which grows rapidly, much faster than any other part of the baby's body. So generally, these lesions, it will be present at birth, but it will be very minimum. But as the baby goes by, baby's age goes by, the lesions also gets bigger and bigger, and it grows for some months, and then gradually by the end of 2 to 4 years, most of these hemangiomas are disappears. So it's usually not possible to predict how long the hemangiomas takes to disappear. But again, the smaller the lesions, the faster they disappear, and larger the lesions, it could take many years. So many of the leaves hemangiomas, they doesn't need treatment, as I discussed. They will regress on its own over a course of time. But the ones which will be see on the face, on the eyes and lips, are in the genital area. Those requires interference with body functions, those requires treatment. The treatment is medical or sometimes surgical also. So this is how this hemangiomas looks like. So previously, these infantile hemangiomas, they used to call it as strawberry hemangiomas because it looks like a strawberry and it's quite pinkish also. So the next common birthmark which we see is the nevus simplex. Also, medical term we call it as stork bites or angel kiss. So the many of the parents will be concerned about this lesion, saying above my baby's eyes there is a lot of red lesions are there, and even on the back also. This is what we call as stork bites. Again, this is basically a reddish patch of skin between the eyes on forehead or on the back of the neck. So this is basically because of the dilated blood vessels that give the skin a reddish color. Most of these lesions disappears by 18 months to 2 years. So as you can see, there is a reddish lesion on the back of the neck and in the eyes as well. This is what we call a stalk bite or nevus simplex. Then comes the Mongolian spots. So Mongolian spots, this kind of lesion we'll see in Asian children's. This is a gray to bluish areas of skin that looks like some bruises. That's some trauma which has happened. That's why the baby's skin looks like that. So it is not because of that. It is just a normal appearance of the child which we see. It generally fades away by 2 years. You can see there is large of a greenish to bluish skin lesions, which we will see on the baby's back and the trunk as well. Then the another birthmark that we come across is melanocytic nevi. The melanocytic nevi, these are commonly which we called as moles. Moles basically they are basically a pigmented cells. They are basically cells which form a pigment, melanin. So they cluster and form a nevi. So the color of the skin looks like brownish to dark. So the lot of babies will have these tiny moles since birth or in the first few months of life. So many of the times these moles, if it is small with the age, it will regress. Otherwise, also if it is not regressing, the size of the moles are increasing, then we need to be worried because sometimes they might be sort of precancerous conditions also, which we need to discuss with the dermatologist, and we have to go further. Then the last which common birthmark that we see is called as vascular malformations and also what we call as port wine stain. So this is a port wine stain which is a diffuse erythrogamic structure that we will see mostly on the face of the baby, otherwise sometimes on the other part of the body as well. So this is a dark red areas like structure, which is basically because of the dilatation of blood vessels, and many of these vascular malformations sometimes associated with uh, there is lesions, the similar kind of lesions in the brain and eyes. So whenever we come across these port wine stain, so we need to screen the baby's brain and eyes to look for similar kind of lesions, because these are the ones it sometimes been associated with the similar vascular malformation in other areas also. These birthmarks are they're not going to resolve on its own. They will stay with the baby for the rest of the life. So these are the common birthmark as well as the skin lesions that we discussed. So many of them, these lesions are self-limiting, apart from a few of them. So especially the vascular malformations and some of the cases of this acne neonatal. Otherwise, most of the lesions are self-limiting. So we don't have to be worried as long as they are getting bigger. And all. Thank you. Welcome.